Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, the Executive Director of Speaking of Women's Health, and I am so glad to be back in the Sunflower House today. And joining me in our second season of our Speaking of Women's Health podcast is just a terrific woman, pediatric dentist, Dr. Rachel Rosen. And she is a diplomat of the American Board of Pediatric Dentistry. And it's a very prestigious title, and it indicates that she successfully completed a lot of voluntary examinations, and she's demonstrated specialized knowledge and skill in treating children from cradle to college. She is also a TBI, which stands for the Breathe Institute Ambassador, who has extensive laser tongue tie and lip tie release training and experience. Dr. Rachel has a passion for helping her patients achieve optimal overall health and development through combining her knowledge of pediatric dentistry, airway dentistry, and myofunctional therapy. And on a little personal note, Dr. Rachel Rosen really helped me out when I was a very upset Mimi. I got a call from my son Stetson, and his daughter, who was 2.5 at the time, thought she was a superhero. She jumped off of a couch and smashed in her teeth and hurt her lip and was bleeding. And he said, "You have to get me a pediatric dentist." And she came right to the rescue and saw Artemis the very next morning, and I'm happy to report 6 months later, she is perfect. So thank you so much, Dr. Rosen. We're so excited to have you as a guest on our podcast to talk about everything that moms and dads and mimis and sirs and family members need to know all about children's teeth. Welcome.
Thank you so much for having me, Dr. Thacker.
Yeah, so how did you get involved in wanting to be a pediatric dental specialist?
I've always known dentistry. That was like the easy route for me, but I love working with kids. And I didn't have a pediatric dentist growing up. And I think some of those fears around that, I wanted to create an environment where kids felt safe and welcomed, and we have a lifetime of dentistry. And I was like, this is such an important field, and there's so much we can start young and kind of grow a really good relationship with. So that, it's rewarding. Every day it's really rewarding.
So you have just such a wonderful office in Northeast Ohio in Twinsburg. It's so child friendly. It was so bright and happy and cheerful and engaging, because I know when I was in medical school doing training, I just didn't have the patience for children. You know, they couldn't really have high level discussions or always cooperate. And they were so tiny. It was just really too much. So I've always had a special place in my heart for people that specialize with the tiniest little humans. And I'm so fascinated that you're interested in airway issues and TMJ, TMD. Tell us how you got interested in that and why that's important even in children. We certainly know it is in adults. I see problems every day.
Right. And I think that's the kind of where it all stemmed from is, seeing kids in the practice who were older and saying, what's going on? Why do we have dental cavities? Why are we anxious in the dental chair? And peeling that back to where it all started. And I got my start when I did my residency in Boston University and did my clinical research on the overdiagnosis of ADHD with sleep disordered breathing.
Oh, interesting.
Yes.
Interesting.
So it opened a huge kind of just start of my passion for this, saying there's more that's going on than what meets the eye, and looking at full body health. And when I joined the practice in 2016, we had a laser, and me along with Dr. Edelman at the time were like, let's dive into this. And we took so much coursework and really did our due diligence and research over quite a few years. And it continues, because it's such an evolving field, to say, how can we do better? And how do we not just treat a disease that we shouldn't have, which is dental decay? And it's very correlated to what's happening from the way we breathe and the way we sleep.
So, like mouth breathers, does that change the oral microbiome? Is
All
that
of
part
it.
of it?
Yeah. Oh my
Uh-huh.
goodness. So you're gonna get me down this like huge rabbit hole, Dr. Thacker. So I mean, it starts in infancy. So I see children in the practice anywhere from 5 days old, give or take, up until 21. Um,
Mm-hmm.
and I'm looking at what our airway's doing. So how our palate is developed, how we're breathing. And as an infant, if we can't feed well, there's a reason for that. Um, and then that can lead into not being able to take solids well, which can lead into speech and sleep. And it all goes back to our palatal shape, our nasal passages. And yes, exactly. That's the key of it, is being able to nasal breathe, because nasal breathing is what our body wants us to do. Well, when you're a chronic mouth breather, it changes the overall shape and development of your lower jaw and upper jaw. And all you're doing at that time is giving your teeth oxygen at nighttime while it's open, and you're not using saliva as your buffer. So yeah, your oral bacteria definitely changes and it's growing more significantly. And there's a lot of things we can see, patterns on teeth, that tell us that we know our patients are doing some type of sleep disordered breathing, which then leads to a higher cavity rate.
Wow.
And
So how do you treat that in children? I know in adults, we recommend weight loss and mouth guards and nasal CPAP and
yeah.
sometimes the Inspire device, but I don't imagine that you do that with children, do you?
No, and I
Yeah.
think that's such an important thing, because parents come in like, oh, that's so me, right? As we're talking about, they're just like raising their hand, like they totally get it.
Yeah.
And as an adult, we tend to end up band-aiding things more and just saying, what can we do to at least get us by? Well, in kids, we can affect the growth and development. So, depending on the age and level of cooperation, I like to work with an airway specialist orthodontist to start creating the right space and the right room for them. Because if we have the right framework, that upper palate is connected to the base of the nose. So, by expanding that upper jaw, we're expanding all the nasal passages. And then once we have the right framework, then we can talk about the oral motor function and what is actually going on. Because there's a reason you got there. There's no, why is our palate smaller? And we talk to parents about this all the time. And we look at that. Our teeth should fit in our mouth, but when they don't, our body has some type of disruption going on.
And
Um,
so does thumb sucking, is that the reason why dentists don't want children to suck their thumb after 3? Does that push the palate up?
Absolutely. So, and it's so, I always tell, I have this kind of double side of me, because my dental training is in looking at teeth and knowing thumb sucking so bad, and we shouldn't be sucking our thumbs and we shouldn't be using a pacifier. But the airway dentist in me totally understands why a kid is doing it. And they're doing it because it's helping them breathe. So they're putting that thumb in, they're putting that pacifier in, they're moving it out of airway space. And basically, they're creating what I say is their own yoga breath, right? When you're really anxious, they say, take a breath through your nose. Well,
Yeah.
right. So, what does that do for a child? It creates nasal breathing. And then what they're doing at that point is they're now regulating and relaxing and delivering nitric oxide to put themselves into a more calming state of sleep. So, yes, ideally, if we can stop these habits close to 3, we can then get kind of around 4 is kind of where you stop a lot of your growth and development. As wild as that is, it sounds so young. Um,
Yes.
but between, that's what I tell parents. But at the end of the day, I don't want it to be a punishment. I get why they're using it. And to me, sleep is more important. Um, and we can fix the other things. And that's so solvable. And I think parents find that really reassuring, because I think they expect to come to the dentist and get reprimanded that their child is still doing something. And I really try to spin it and explain to them why, and not just tell them to stop, and come up with solutions that
Um,
work.
is it true that like breastfeeding helps bring the jaw forward and helps with facial development, more so
Yeah.
than bottle feeding?
And absolutely. But when you look at, and that's where, a lot of this stems from the beginning, is that when we look at kids who can breastfeed well, a lot of babies who do really well breastfeeding, it's because the tongue function is correct. Meaning and our lips, right? So if we can get great seal, a deep latch, tongue to come up, the lateral borders to suck and express milk, we're doing a few things. We're using the correct oral motor function, number one. And number two, we're getting good breast pressure on the roof of the palate and we're developing that well. So if you have good oral motor function, you can breastfeed well. Typically, you continue to develop with that. But when I have parents who say, oh, yeah, I had to give up on breastfeeding, or they told me my supply wasn't great and I had to stop, it's not, I don't say never. Rarely is it a mom issue. Most of the time, it's a baby issue that just wasn't caught.
Oh, interesting. Interesting.
Yeah. And
Wow.
I think a lot of times parents put blame on themselves. And I have these moms, I'm like, it's not you. Let's figure out what's really going on.
Wow. So I never even thought of a pediatric dentist being involved, like maybe with a lactation consultant or helping to consult in those areas of early infant feeding. But it sounds like new parents might want to consider that, especially if they're having
Yeah.
issues.
Oh, absolutely. And that is where my specialty has really grown to, is that I work with infant feeding specialists all day. I work with body workers all day. I'm very pro having a team approach and how I treat the babies. Um, yes, I look at function, but I tell parents my specialty is not feeding, right? So we need to get you the right team to figure out what's actually going on. And a lot of it is related to these oral restrictions, as most people know them as, tether oral tissues or tongue ties or lip ties. Um, so we
So
kind of,
is tongue
yes.
tie when the frenulum is like really short? I know my grandson, who was born a year ago, they clipped the base of his tongue when they measured something in his mouth, and he was borderline right before he left the hospital.
We'll be back after a quick break.
Have you ever experienced fitness failure? You set a goal to exercise, you're all excited, and then you're not. Hi, I'm Dave. I host the daily 10-minute podcast, Walking is Fitness. Instead of an exercise goal, I talk about making a fitness promise. And every day you keep that promise, you add another link to a growing fitness chain. This is a podcast of action. You'll create a fitness habit, which eventually becomes fitness momentum, and then on to all kinds of good stuff. Check it out. Walking is Fitness, and let's take a daily 10-minute walk together.
And it's an interesting field and a lot of things are evolving and we're learning more, but we're all connected. We all have a freedom. So it goes back to how is that freedom functioning for you? And I don't go by what something looks like. I truly go by I do a full functional exam and I go by the baby and mother symptoms because that is giving us more of a story. Because something might look bad to someone's eye and the kid does really well, and something that might not look bad actually is not functioning optimally. Um, so it's an interesting way we word it as a society because we're all tied. We are all connected. So I
Of
look
course.
at right, and I think
Hmm.
that's where a lot of it comes to be like, oh, it looks bad, let's just cut it. But we have to look beyond that. Um,
Ah.
so some are more what we call anterior, and they look worse to the eye, and they're shorter. Some are more posterior, um, and and there's unfortunately, and this is part of where dentistry really needs to catch up. And just, I mean, not even to everyone in general in medicine, there's not a functional grading scale. Sorry, there's not a universal grading scale.
Uh-huh.
So, there's a lot of people who have come out with their own. So when I say to a parent, your child is a grade 3 tongue, they're like, well, it doesn't mean much unless they know what I'm telling them. So I really try to involve them in showing them what the kid is doing. I take videos, we watch it, so they can see what I'm watching functionally
Hmm.
to decide.
And what's lip tied? I've never heard that phrase.
So yeah, so lip tie that's the freedom that connects right at the upper lip, kind of in the
Oh,
that
okay.
best, and we all have it, right? We're all connected. Some are longer
Hmm.
than others, but again, what happens is when it's tighter and more restrictive, you can't fully flange and flip your lip out. So a lot of these babies will have what turns into a lip flip when they're feeding, and they get lip blistering and they're overusing their cheek muscles to feed. So especially in really young babies, you can see a lot of broken blood vessels. Um, and that's where these parents they'll get mastitis. They will get, um, a lot of just nipple pain, those kind of like the nipples that look blanched and flat, it's because the baby is actually chomping versus expressing milk.
Wow. Wow.
Yeah.
That is something. There's so much.
So much. And so, and that it's so interconnected and so real. And it leads to, if we can breastfeed well, and if we can't and we can fix that, right? What's the next thing? Well, these same oral motor functions are so important for solid feeding. So we shouldn't be a picky eater. Like, and it's like, oh, it's just toddler. And I think a lot of things become very normalized because they're common, but they're not normal. We should
Oh,
be
so picky
eating.
eating's not normal, huh?
Picky eating, you should not be a picky eater. We should eat textures and varieties. So most kids who
Okay.
are really picky eaters cannot do it. It's because there is an oral motor dysfunction that is not allowing their tongue to work correctly to move food to the center of the mouth to swallow.
Oh, so is
Um,
there like physical therapy for that or?
yeah, I work with amazing occupational therapists who do great oral motor work, and it takes someone very specialized in these fields. And um, you know, and looking at, and, we can rebuild motor function. That, our tongue's the strongest muscle in our body. So we can strengthen it. And I definitely equate that to, kids when we talk about it. I said, this is like physical therapy for your tongue. But again, when your tongue is not functioning well, you're not putting at the roof of your mouth to sleep well. To take a good breath through your nose, your tongue has to sit at the roof of your mouth all night. Therefore, we're not developing our palate well. Our teeth have no room, so we're overly crowded. That's where you get into this mouth breathing because that's the only way you can sleep, which then you go down this whole, cavities and
Hmm. Well, I've often wondered in my granddaughter if the reason she puts her two fingers in her tongue is to actually retract her tongue to open up the back of her airway. Because at least in adults, a big tongue when they lay back can,
right.
cause obstruction.
That's exactly what's happening. And that's how I explain it to parents, right? Fingers, thumbs go in, and it's depressing and pulling the tongue out of airway space, sealing the lips, and you can breathe. But what you're doing in that, unfortunately, you kind of end up on this hamster wheel. It's like, how do we get off of it? Because
Right,
we're
right.
training the tongue muscle to stay down. So now we're forming these patterns. But it's helping her sleep. And in turn, we're narrowing the palate.
Yeah.
So, which is not
Which you don't want.
absolutely you don't want. But that's
Hmm.
all solvable, right? So how do we tell a 1, 2, 3 year old to stop doing that? It's really challenging. Um, which
She
is
says
why
four. Four is the magic age, is what
of
she
course, am
told
I
me.
right? She can do it. And I always ask, I make the kids part of the conversation. If I have a kid who's like, yeah, I want to do it, and there's lots of prizes, we talk about those things. But if they don't want to, it becomes a punishment, and we just wait till we're older and we figure it
Uh-huh.
out. But to me, sleep quality is what's providing overall health. And if we have good
Hmm.
overall health, then we're going to have good dental health and we're going to have great behavior. We're going to have, great oxygenation, school's going to go well. The things that we
Hmm.
take for granted. Um,
So, what are some of the early treatments to prevent airway disorders that might start in children but then manifest in adults? Because I see sleep disorders every single day.
yeah. And it starts by, it, it all depends on the age. And I think it depends on what the symptoms are and what each kid's having. Um, when you start infancy is a lot of oral motor work, and tongue or lip tie releases if needed to get everything working well. As
Hmm.
we get a little bit older, sometimes we can do some things called myofunctional therapy. Um, it gets a little bit tricky in like the 3 to 4, 5 year olds because it's oral motor therapy that you're asking them to do
Hmm.
round the clock, and it's a lot of work. But if we can get really good, and myofunctional therapists are especially trained to do basically oral therapy of the mouth, right? All those myofascial muscles.
Uh-huh.
Um, so they'll work with them. There are some small appliances, but I find that once in a while I can get a kid to use them. So like a Myo Munchie or Myo Infant Trainer, which kind of sometimes, but it doesn't always give the same sensation. And if they're already tight for space and I'm trying to throw something a little bit big in their mouth, they don't like that.
Mm.
Um, if I have kids who are, 3, 4, 5, and they're already diagnosed with sleep apnea and we're having severe feeding issues, then I'm sending them to the orthodontist early and we're going to start expansion early and create
Okay.
more space for them.
Hmm.
Um,
Wow.
yeah.
That's why sometimes I see young children with braces, which I would think I just
Right.
thought, oh, that's too young, but it's not
It's
necessarily.
not. No, and
Wow.
what we used to do is we waited for our teeth to come in, and then if we didn't
Right.
have room, we took teeth out. And what we do when we take teeth out is we close in jaw space. And what we're finding is that now by closing in jaw space, we've closed off tongue space. We've created mouth breathing, which then creates what we're talking about: sleep apnea, chronic headaches, TMJ, broken down teeth. People are saying, "Oh, I fractured my teeth. I'm stressed. I'm grinding." Those are all signs of sleep disordered breathing. We should not be doing that as a child or an adult. Um,
Wow. Wow. So you have been listening to the Speaking of Women's Health podcast, and I'm your host, Dr. Holly Thacker, the director of Speaking of Women's Health. And we have a pediatric dentist, Dr. Rachel Rosen, talking to us about everything pediatric dentistry, breathing, feeding, airway. um, I wanted to move on to dental trauma because it's so
Mhm.
traumatic when anyone injures a tooth or loses a tooth or breaks a tooth, and it's usually at night or on a weekend or at a party or something when it's just kind of crazy and wild. And is it true that if a tooth gets knocked out, you put it into milk? Like, what are some basic emergency tips for
Yeah,
all
absolutely. Oh,
moms and mimis and family members?
first of all, you were so right, Dr. Thacker. It's always a Friday or a Saturday. It's never when I'm in the office Monday through Thursday, um, which I don't mind. So yes, there's two different types of trauma, right? So we have adult tooth trauma and we have baby tooth trauma. Adult tooth trauma is what is emergency. Like tooth, if you knock a tooth out, it's going right into milk, and you're calling your dentist. That
If you don't
is
happen to have milk for some reason, then water or is
Water's okay. Some people say pocket it if you have an older kid, pocket into their little like vestibule of their lip.
okay.
You don't want to keep it dry. I mean, you don't. Sorry, you do not want it to be dry. So you want to have
Okay.
water. Water's okay. Milk's ideal. Um, which is and if you break a tooth, if you break a permanent tooth, try to find the piece because we can always kind of re-glue back on that piece together
Oh, wow.
versus building you up a whole new piece. So even if you find the piece and it's not a full tooth coming out, a piece of it goes right into milk as well. Um, it's almost like we can get the puzzle back together. Um,
Ah.
as far as baby teeth go, it's very different. You knock a whole baby tooth out, happy tooth fairy. We're not putting that back in. Um, if you fracture it or you move it, which is what we call luxation, those are things that then we have a little bit more. I tell the kids, I'm like, we're gonna be married for a while. We got to follow this for quite some time, um, because baby tooth trauma, it depends on the severity. Where things that are common in adult teeth are actually very different in baby teeth. So in an adult tooth, a discolored tooth tells us that it's dying. A baby
Ah.
tooth, a discolored tooth tells us, okay, we're trying to heal ourselves. So a lot of times it's amazing what a young body can do and how well it'll heal itself. So I tend to be a little bit more conservative in my baby tooth treatment. I don't like to play heroics all the time or jump to conclusions. I really like to give the body a chance to heal itself. I always, especially with my patients, they know they can call me, send me photos, videos, and I'll look at everything and then we'll kind of go through each thing one thing at a time. But a lot of times people think you need to fix it or you know put a huge crown on it or take it out right away. um, we at our office are more like let's wait and see. So if the tooth just moves a little bit and there's some bleeding, okay, that's okay, we can leave that be. The tooth fully comes out, it's going under your pillow. If the tooth fractures and it breaks, it depends how far the break is. If it's into the nerve, well, then we have to have conversations about, does it need a root canal and a crown, or do we just take it out? And again, that depends on the kid's age.
Do you do root canals on baby teeth?
We do.
Really?
I
Wow.
don't. Yeah, you can do them on front teeth and back teeth. I don't love to do them, because a lot of them the failure rate's pretty high. But if we have to, we have to. And we talk about, again, I like to treat a baby tooth once. So again, depending on the kid's age, if it's a 3, 4 year old, we're doing the root canal. We need these teeth to last some time. If
Mm-hmm.
the kid's 9, 10, maybe we talk about taking the tooth out,
Mm-hmm.
and not letting it sit there. It's not a root canal like an adult tooth root canal. It's just we go into a little bit of the nerve, put some medicine down. So it's just an extra step for us. But We do them.
Yeah, boy, I went through a number of issues with root canals after I had multiple babies and breastfed. I didn't know if it was some nutritionally deplete stuff or, just other reasons, but that's a big deal. So I would think, having that for children would be, wow,
It,
something.
yeah, it's a lot easier in a child, I will say.
I bet, and
But
they heal so fast, and it's like
yeah,
I was so worried that Artemis was going to lose her tooth, and it was perfect. You followed it. You did
right.
conservative therapy, and saved her tooth. Whereas maybe if she'd just seen a general dentist or someone else, maybe that might not have happened. So,
And that does happen, and that's part of why, I'm a specialist, so I love specialists because I know with the training that we've gone through um, to learn these things. And I think, in dental school they teach you very black and white scenarios, but it's not always like that. And it's okay to watch something and see what the kid will do. Yes, it's a little bit more follow up, but it's easy follow up, and we just
mhm.
check on it. And most times it tightens back up on its own, and they are okay.
Yeah, the healing bodies, the powers of the body are really incredible. And I'm
It's amazing.
sure that like good nutrition and adequate calcium and vitamin D, we've had podcast on that, on speaking of health, speaking of women's health in the past, probably are all, I would assume, extremely important as well for your oral and dental health.
Absolutely. Yeah.
So, it was funny because not funny, but a little ironic. I was like, after my son, like, Artemis has teeth. She's got great teeth, and she's 1.5. Did you make an appointment with the dentist? No, she's fine. Then at 2, I'm like, well, happy birthday. She's 2. Have you made an appointment with the dentist? No, she's fine, mother. We're the parents.
Right.
So finally, after almost 2.5, she did get to see you because of of trauma. But when do you recommend that a child should have their first dental exam?
So the AAPD recommends first birthday or first tooth.
First birthday or first tooth.
Yes.
That's what I did. I did it after the first tooth with my
First, right.
sons. But
And most of it, honestly, and I tell there's a few reasons for it. One is we're getting a kid used to the environment early. Number
yes.
two, we're educating the parents. So it's a lot of it is parent education. The appointments are quick for the kid, but it's let's make sure things look right. They're growing correctly. And explaining to them what the expectations are at each age and what we should be doing at home. So a lot of it is mostly for the parents. So, and if we catch things early, I can offer you very small options. I can offer you preventative options. But by 3 years old, I have kids with a mouthful of decay that I could have
Oh
prevented had they
my.
been there earlier. Yeah.
Oh my, yes. And as soon as there's a tooth or two, you should start to like brush with non-fluoride toothpaste. I mean,
Yeah. So
is
I'll
that
tell you what this is what my philosophy is. Clean teeth. If the teeth are clean, that's what matters. So
hmm
once a tooth starts to come in, honestly, sometimes even before, I recommend just getting one of those like little silicone toothbrushes and starting to brush the gums and getting them used to having something in their mouth.
uh-huh.
But brushing is what gets the teeth clean. Toothpaste is flavor or vitamin. So even a non-fluoride toothpaste, it's just yummy for the kid. It doesn't do anything to clean the teeth. So initially, you're going to start by just brushing. As the kid wants to be a little bit more independent, it's really nice to say, okay, you know, grown up takes a turn with a toothbrush, and now you get the toothpaste. That's your little reward on there. Because that's
hmm
what they like. That's the best part. And once teeth start to touch, you're going to floss. That's really important too. So even, I have a 1-year-old, 2 front teeth are touching, we floss, which I think parents kind of forget that, like, oh yeah, we still need to floss these teeth. Um, and I always say, even where there's no teeth, still brush because all you're doing is you're getting to the areas where teeth want to come in. You're helping break down that gum tissue and helping teeth erupt at a better rate. And then they're
Ah.
used to it, right? The teeth come in, you're like, oh, we're already brushed back here every night. And you figure out that the tooth came in.
Is
Um,
there any time that you get concerned if teeth haven't erupted? My 1-year-old grandson is just now starting to get teeth, and I was thinking,
yeah.
my other children, they always had teeth, by 6 months.
Right. And so, like, 4 to 6 months is early average. But
Okay.
I have plenty of kids that it's between 1.5 that they just start to get teeth. And
Wow.
And that's okay. Order matters more than age. I would say by 2, if there's no teeth, I'd be a little concerned. But most of the time, parents who you're like, oh my goodness, they'll make an appointment because their kids, one has no teeth. And by the time they get in for their appointment, they're like, I made this appointment a few weeks ago and now they have a tooth.
Now I have teeth, yeah.
Yeah.
And that toothless grin is just so
Yeah.
adorable, and it doesn't last very long. So
Right.
enjoy it, parents.
Well, and what ends up happening is you lose them later. So a 1-year-old who gets their teeth is probably losing teeth closer to 7. So it's that much longer that we wait to have permanent teeth, which is good because we're living
Yes.
longer. We have to keep our teeth longer. Um, so I don't mind. I'm like, I don't care if you get them later, but it's just getting in those good habits.
Ah,
And the other thing we really talk about too is, doing a lot of diet with the kids. And by diet, I mean talking to them about things that are better to eat or drink for our teeth.
mhm.
Um, which we always say, water's the best drink. Even milk has natural
Yes.
sugar. So parents think it's okay to put your kid to bed with milk. I'm like, no, we got to brush these teeth after. This is so important. Um, if you're breastfeeding, we got to wipe things down at least once teeth
Mhm.
start to come in.
Mhm. And
And
I would think a lot of high sugar or really sticky foods would be
absolutely.
worse.
So textures matter. Things that melt will melt off the teeth. So an ice cream, a chocolate, a popsicle is going to melt. A cookie, a brownie, a fruit snack, a crunchy chip, especially like a goldfish, that crunchy carb and that sticky sugar
Mhm.
sit. And kids don't self cleanse. They just don't. You and I would eat something, it'd be stuck in our tooth. We're trying to get it out. They'll let it
Mm,
sit there. They don't care.
right.
So
And so is it better then for children to learn to sip through a straw because then they're just swallowing the liquid if there's any sugar in it as opposed to just drinking it out of a cup, or
if you're
is it?
drinking you're saying a liquid other than water.
Yes.
Yeah. Yes, in theory, yes, a straw. The quantity of the liquid matters less than the time that you're drinking it. So if you're having a milk, a juice, drink it with a meal and be done. It's when you're sipping, throughout a playtime or there's a movie and you've chronically exposed your teeth to sugar for over 20 minutes. Well, now we haven't given our body a chance to reach an equilibrium.
Mhm. Mhm.
And that's when it's bigger. So I'm like, have your drink, but have it meal, breakfast, it's done. Meal clears, so does the drink.
And is there anything to like hydroxyapatite, mouthwashes, or
Great
toothpaste for
question.
better
Yeah.
for the microbiome?
A lot of the newest, research, and there's a lot of people who, they don't want fluoride. There's a lot of bad studies out on fluoride. The one thing I'll say about fluoride in general is that the fluoride that we talk about in our water is very different than dental fluoride. Most of the water fluoride is potassium fluoride versus toothpaste fluoride is sodium fluoride.
Mhm.
That being said, I think there's a balance. There's a lot of great new research out on hydroxyapatite,
Mhm.
and there's a lot of brands that are now making hydroxyapatite toothpaste and mouthwash. I like a nano hydroxyapatite because the particles are smaller, so they can penetrate easier.
Mhm.
And you're seeing it's naturally it's already in our body, right? It's a naturally remineralizing agent. So if we're using something like that, we're putting something natural back in our body. As
And
far as yeah,
is there anything to like xylitol gum to chew that to cleanse your mouth if you're not able to, like, say, brush your teeth and
yeah,
you're
I,
old
I'm
enough to chew gum?
I love gum. Any sugar free with xylitol is fine. What it's doing is just stimulating saliva, right? So you're using that gum, it's going to break up particles. You're stimulating your saliva. Your saliva has good bacteria that's helping balance it. Um, and I definitely would not use anything that has like an alcohol base. Like those alcohol based mouthwash are
Mm.
killing off good bacteria, and we
Yes,
don't
yes,
want to
and
do that.
at least in adults, I tell them that it can increase oral cancer. So just like we recommend people not drink alcohol or not
Hmm.
drink very much,
Hmm.
we certainly don't want you to just have alcohol mouthwash because that can actually increase oral cancer.
That is,
S-
yeah, that makes total
Yes.
sense. Yeah, because you're doing the exact same thing. It's not good.
S-
It's not good for your whole gut biome either, right? It's the whole thing.
Right, right. So
Yeah.
as we're wrapping up, any other pediatric tooth care tips or parting words you want to leave us?
Um, no, I think just honestly, I think just trust your gut as a parent. I think a lot of times, we try to ask so many opinions from so many professionals, but if your mommy gut or your daddy gut or your parent gut, says something's off or something's going on, definitely reach out to a professional because I get a lot of parents like, I wish I came sooner. I thought something was going on. Um, Once you can see a cavity, there's more than one that I will tell you.
Oh,
So,
wow.
yeah, once you can see it with your eye, it's going on all over the place. And just clean teeth, lots of water, melty snacks, good breathing, good sleeping.
That sounds wonderful.
Yeah,
And before we go, can you tell us a little bit about yourself personally? You have a baby, right?
I do. I have a 1-year-old baby,
Uh-huh.
and we have another one on the way.
Oh,
We're 202.
congratulations.
Thank you. Thank you.
When
And
are you due?
I am due end of March.
Oh, exciting.
So
Oh,
yeah, I
that's so
know it's really
exciting.
exciting. But he had a tongue and lip tie release and we're going down the journey. So I try to he's become my little model for my office. So if anyone's ever looking for tips and tricks, you'll see him a lot on it because I try to utilize what we're doing at home and post it. So
Oh, that's great. And how do you have some social media or ways that people who are listening can
yes.
contact? I know that you are at Great Beginnings Pediatric Dentistry.
Yes. Great Beginnings Pediatric Dentistry. We are GBPD for Great Beginnings Pediatric Dentistry. So gbpdsmiles.com and our Instagram is gbpdsmiles.
Oh,
Um,
Instagram. And your phone number
Instagram.
is 330-425-1885 for
Yes.
appointments.
Yes, absolutely. And we I will see anyone, like I said, 5 days old up until 21. So we have and I just love what I do. I love our team. I love what I do. We have a fun office. So we welcome everyone.
Well, thank you so much for joining us on the Speaking of Women's Health podcast. And thanks to our listeners for joining us on
Yes.
this episode.
Thank you
And
so much, Dr. Thacker. I appreciate you inviting me.
hopefully we can have you come back and maybe get some shots of your great office. I mean, it's
Yes.
just tremendous. And we've really just appreciated this. And we'll put that contact information and your Instagram and website on our show notes.
Awesome.
And so thanks again to our listeners for tuning in. If you enjoyed this episode and you want to help support the podcast, please share it with others. And you can always donate to the nonprofit, speakingofwomenshealth.com. You can simply leave us a 5-star rating. The other day, I was showing a patient how to subscribe for free on the podcast app, and I accidentally hit 2 stars. When I was moving on the phone, and I'm like, oh no, I hit 5. She's like, oh, that's funny. You're giving yourself a 5-star rating. But the higher ratings, helps us move up in the ratings. And it is free on Apple Podcasts, Spotify, TuneIn, iHeartRadio, wherever you listen to podcasts. So we hope you join us for our next edition. And thank you very much.